And we're presenting our combined monotherapy data today. That's from 3 trials. And these are patients who were not adequately treated on their anti-epileptic treatment. They were titrated off and then treated as monotherapy with a single drug with Aptiom. And we found that there was significant effectiveness and efficacy in those treatments. Now, why this is important is that compliance is a very big problem. And when people are on multiple drugs, particularly drugs that have to be taken several times during the day, compliance is really bad. Monotherapy is important not only to improve compliance, but our drug is once per day. So that helps as well. The oral presentation that we're going to present gets at that very question regarding monotherapy versus those taking multiple drugs. We've known for a long time that people who are taking multiple drugs have a higher burden of illness. That means the costs are higher. It also means that these are patients who are suffering with breakthrough seizures, other illnesses, medical illnesses as well, so the burden is substantial on multiple treatments. And it makes sense because with monotherapy, it's easier to take one drug than many. However, there hasn't been a lot of data that shows that. We undertook a very significant study, over 50,000 patients during a 6-year period in a very extensive database. And in that database, we in fact proved that hypothesis, that those that are taking multiple anti-epileptic treatments, in fact, have a much greater burden of illness, higher costs, and so on. And that's being presented here, and we're excited about that. The dose that we used in our monotherapy studies are 1,200 milligrams and 1,600 milligrams. The dose for the approved indication as an adjunct is 800 milligrams and 1,200 milligrams. So the doses that we used in our monotherapy trials are higher. Now keep in mind that we are not approved for monotherapy. We did submit an application to the FDA, and we expect to hear from the FDA in the 3rd quarter of this year. Well, in fact, our combined monotherapy data showed that the drug that Aptiom was well tolerated, and there was a headache that occurred in over 5%, but this is a well-characterized drug that's tolerated by patients. Unfortunately, epilepsy is lifelong, and there are such significant dangers in stopping medications. That's why monotherapy is so important. Aptiom is a once-a-day drug. As monotherapy, we believe that compliance will be better. We've shown in our health outcomes data that in fact the burden of illness is much less with monotherapy, fewer side effects, and lower costs in general, a better quality of life for patients who are taking one drug versus several. So patients will have to remain on their treatment in general to avoid any breakthrough therapies. Aptiom is not scheduled, which means that there's no abuse potential associated with it. That's very helpful because some anti-epileptics are scheduled, and it makes it difficult to not only prescribe, but also there are problems with potential for abuse. The other thing is that Aptiom can be crushed, and that's very useful in people who can't take the oral pill.